Hi all, welcome to Inspired Surgeon. Chittiram Pesiranga series. We encountered many rules, flaws, and phenomena in surgery, and now we are going to discuss all these things in this video. Disclaimer is shown in the description. Based on this image, would you get any idea of this? A diagnosis in the 70s, localized disease and metastatic on your left side, and diagnosis in the 90s, where the investigation modality changes, the diagnostic accuracy. So, Will-Rogers phenomenon, also known as stage migration, is an epidemiological paradox where moving an observation from one group to another can improve the average of both groups. This occurs when a more sensitive diagnostic tool allows for the detection of a disease at an earlier stage, leading to a reshuffling of the patients into a different prognostic groups without any actual improvement in individual patient outcomes. Here is a more detailed explanation. The Oki paradox. The phenomenon is named after a quote by Will Rogers, who joked that when Okies, a people from Oklahoma, migrated to California during the Dust Bowl, they raised the average intelligence of both states. This is because the individuals who left were likely among the least intelligent in Oklahoma, and those who arrived in California were likely smarter than the average Californian. Look at this video. Courvoisier's law, also known as Courvoisier's sign, describes the observation that in a jaundice patient with an enlarged palpable gallbladder, the cause is unlikely to be gallstones blocking the common bile duct. An image showing the duplication of ureter based on this Weygert-Meyer law predict the anatomy of duplex collecting system. The upper pole drains infromedially, whereas the lower pole drains supralaterally. So upper pole and ectopic insertion medial and caudal often associated with obstruction and ureterocele. Lower pole normal insertion but often associated with reflux. What is Stephen's ectopic pathway? Stephen's postulates breaks this principle about ectopic pathway. The ectopic pathway is not only drain distally to normal ureter insertion, it can be supramedial to the normal insertion. What this image depicts: a differentiated tissue on your left side and a tumor tissue on the right side. Normally, glucose on oxidative phosphorylation converted to carbon dioxide at the end as the end product with 36 moles of ATP through oxidative phosphorylation, whereas a tumor cells shift glucose to lactate and thereby it will inhibit the prevention of glucose to be utilized in oxidative phosphorylation. Cancer cells utilize the glucose for rapid ATP synthesis and biosynthesis of the cell wall, and thereby promoting the tumor microenvironment and cell signaling, and this is what Warburg effect shows. Increased glycolysis. Cancer cells glucose consume significantly more glucose than normal cells. The lactate production, even in the presence of oxygen, cancer cells convert most of glucose into lactate, a process called anaerobic glycolysis. Compared to normal cells, cancer cells utilize less glucose through oxidative phosphorylation in the mitochondria. Clinical significance: we can able to target the cancer cells through this method. Pheochromocytoma, rule of 10. 10% malignant, 10% bilateral, 10% extraadrenal, 10% calcifies, 10% present in children. Rule of 7 in the neck. 7 days inflammation, 7 months neoplasm, 7 years congenital defect. The rule of 7 provides a probable diagnosis of neck mass based on the average duration of the patient's symptoms. Rule of 80. 80% of non-thyroid neck masses are neoplastic. 80% of neoplastic neck masses are seen in males. 80% of neoplastic neck masses are malignant. 80% of malignant neck masses are metastatic. 80% of metastatic neck masses are from primary sites above the clavicle. So what is rule of 80 in parotid? 80% are benign. 80% of parotid tumors are pleomorphic adenomas. 80% of salivary gland pleomorphic adenomas occur in parotid. 80% of parotid pleomorphic adenomas occur in the superficial lobe. 80% of untreated pleomorphic adenomas remain benign. What does this image shows? Eddy current. So where does the clinical implication? Cervical rib narrows the scalene triangle bounded by scalenus anterior, scalenus medius, and first thoracic rib below. Compression of subclavian artery C8 and T1 nerve roots due to cervical rib, and because of this, angulation of subclavian artery occurs. It causes constriction of artery at the site where artery crosses the cervical rib. Eddy's current. It mainly created in the bowel and thereby causes sudden release of pressure distal to the narrowing. Post-stenotic dilatation. So if you are having the vessel and there occurs a narrowing, and because of the post-stenotic dilatation there occurs a Venturi phenomenon. So it will be like a dumbbell. So there is a narrowing, and because of this there is a rapid jet-like flow of blood, which is an eddy current, which is because of the sudden release of the pressure which is distal to the narrowing, and this is called as Venturi phenomena because of the vessel wall ischemia, and the stasis of the blood occurs. And features of ischemia in the hand and forearm, later digital gangrene occurs. So what do you mean by Wolff-Chaikoff effect? So Wolff-Chaikoff effect, the intake of large quantity of the iodides, which will inhibit the further release of thyroid hormones. So simple to remember, off. So if you take iodine, it will off. So thereby iodides will inhibit the further release of thyroid hormones, inhibits organification by autoregulatory mechanism, but later may cause escape phenomena. So what is Jod-Basedow effect? Jod-Basedow. So it's a phenomenon is hyperthyroidism occurring in a goiter patient due to the administration of increased doses of iodides. So it is seen after administration of especially iodine contrast agents or amiodarone drug. So like if patient is having contrast and CT, patient will experience hyperthyroidism because of this Jod-Basedow effect. So what is Raynaud's phenomenon? Raynaud's phenomenon is an exaggerated vascular response to a cold temperature or emotional stress. So it is pallor initially because of the vasospasm, constriction of the blood flow, and now it becomes cyanosis, a tissue hypoxia, and followed by reperfusion. Now it becomes red. So complications of revascularization in acutely ischemic limb: a reperfusion injury, no reflow phenomena. It is because of severe capillary edema causing poor peripheral tissue hypoperfusion in spite of major vessel revascularization. I discussed separately Jod-Basedow effect and Wolff-Chaikoff effect in a separate video. Hope you enjoyed this video. Subscribe and share it. Inspired Surgeon. Thank you.